syndrome. By far, the most common chief complaint is chest pain, which is classically described as the worst pain I have ever experienced, or as ripping, tearing, sharp, or like a knife. This pain comes on very suddenly and may be located in the anterior part of the chest or in the back between the shoulder blades, and/or radiate into the posterior chest, back, or abdomen. On the basis of a patient's description, it may be difficult to differentiate the chest pain of a dissection from that of an acute myocardial infarction, but a number of distinctive features may help. The pain of an acute myocardial infarction is often accompanied or preceded by other symptoms, nausea, indigestion, weakness, and sweating, and tends to come on gradually.
It's not trash, then so be it, but usually it's trash. The freaking quality is not the best usually.
Becomes maximal within 1 minute without prodromal symptoms, and often
not that great usually quality.
Table 30-13 summarizes the differences in clinical presentations of myocardial infarction and aortic dissection. Other signs and symptoms of dissection will depend on the site of the intimal tear and the extent of
I don't know why this
In dissections of the ascending aorta, which tend to occur in younger patients previously in good health, one or more of the vessels of the aortic arch are usually compromised. Disruption of flow through the brachiocephalic or left subclavian artery, for example, is likely to produce a difference in blood pressure between the two arms. If you do not routinely check the blood pressure in both arms, you will never detect that sign. You may also find that one femoral or carotid pulse is missing or weak. Always check both radial pulses when suspecting dissection. Disruption of blood flow into the left common carotid artery may produce signs and symptoms of a stroke. When the dissection extends proximally to the ostia of the coronary arteries, coronary blood flow is apt to be compromised, and
Rezo.
myocardial ischemia are likely.
How are you doing?
Death from dissection of the
Been a while.
aorta is nearly always a result of aortic rupture.
Yes, I do,
It may rupture
Rezo.
into the mediastinum and chest cavity, or into the pericardium with resultant cardiac
What's
tamponade.
good?
In the former, the patient will
Damn,
rapidly
spam
develop
call
shock
1
and
sec.
cardiac arrest. In the latter, you will briefly see the characteristic signs of cardiac tamponade.
I do remember you.
Hypotension, narrow pulse pressure, and muffled heart sounds prior to cardiac arrest.
You got good news.
Dissection of the descending aorta
That's
occurs
good
more
news.
commonly in older patients, especially those with a history of hypertension. The pain is apt to be somewhat less severe when the descending aorta is involved.
What's the
Indeed,
good
the
news?
patient may wait a few days before seeking help. The dissection usually proceeds distally, so the aortic arch is spared, which means that blood pressure discrepancies between the two arms are not part of the picture. The pulses in the lower extremities, however, may be affected.
Congratulations.
Dissection of the aorta.
It's very difficult to do that. Proud of you. That's very
in the hospital
difficult.
setting, medications will be given to lower the patient's blood pressure and reduce myocardial contractility to take some of the hemodynamic load off the aorta prior to surgery. Only in very unusual circumstances would such therapy be started in the pre-hospital environment. However, because it requires continuous monitoring of intra-arterial pressure, the steps of pre-hospital management in suspected aortic dissection are as follows. Calm and reassure the patient. Administer supplemental oxygen if the patient is hypoxic.
Listen to my textbook right now. Study for my licensing exam. Coming up pretty soon, my licensing exam, so I've got to study every day and
stabilize the patient's condition in the pre-hospital setting.
work on some
You also will need
questions.
aggressive therapy in the intensive care
What's up,
unit,
Stitch?
possibly surgery, so do not dawdle. If the patient
Making
is
sure I'm not
hypotensive,
freezing.
consider morphine sulfate.
Got double
2 milligrams
streaming right now,
intravenously
so.
per dose. If the patient is having
What's
severe
good?
pain,
What's good,
avoid
Stitch? Nice to meet
acetylsalicylic
you.
acid and nitroglycerin. Expanding and ruptured abdominal aortic aneurysms. An abdominal aortic aneurysm can be found in approximately 2% of the population older than 65 years, and rupture of the aneurysm is associated
At least the internet's not absolute garbage today. Usually my internet's really bad.
To the renal arteries. An expanding aneurysm is, as the name implies, an aneurysm that is getting larger and producing symptoms by compressing on adjacent structures,
Okay.
although the aortic wall remains intact. When an aneurysm starts expanding and producing symptoms, you can assume that rupture is imminent. Signs and symptoms of expanding and ruptured abdominal aortic aneurysms. The typical patient with an
Two streams,
abdominal
yeah.
aortic aneurysm
I got
is
two
an
streams
aneurysm
going on
late
right now.
So long as the aneurysm is stable.
Got
the
two
patient
phones,
usually
two
is symptomatic.
streams, two different
When the aneurysm
accounts.
starts to expand or rupture, however, the patient becomes symptomatic.
Usually
Sudden
it slows down, but on my phone I'm using my data, and this one I'm using this thing.
Often,
I'm doing well,
pain
Stitch. How are
located
you?
solely in the lower back, leading the patient to think he or she has pulled a muscle or mimic the pain from
Two
renal
streams.
colic. The pain is constant and moderate.
Two
to
streams,
severe.
two
It cannot be
phones.
relieved by changes in position.
Gotta
It tends to
grow.
radiate
Like,
into the thigh and groin. If the aneurysm
gotta,
is
like,
blood, the patient may experience an episode
if I'm gonna invest an hour stream, might as well double stream, but this usually doesn't work because the home data thing pod I have is usually trash, the quality. My stream freezes. But today it's not bad. Maybe it's the change in weather. Maybe it's because winter's almost over. I don't know. It is what it is.
Because the definitive treatment requires urgent surgery. The key is to maintain a high index of suspicion whenever a middle-aged
I do remember that video. That was way back in December.
The more likely problem in the pre-hospital
Used to go live a lot.
patient is a leaking
Now I
aneurysm
mostly
that has
post
a
on this channel.
The steps of pre-hospital management in expanding or
Well,
ruptured
thanks for
aortic
sticking
aneurysms
around the whole time, though, Riza. We appreciate
oxygen if
it.
hypoxic.
Congratulations on
Transport without delay. Insert an
beating.
intravenous line en route, but avoid large volume infusions. Use a large gauge cannula, but maintain the flow to keep the vein open unless signs of shock appear.
Yep.
If there are signs of shock,
Today grocery
allow
store
for
closes at 8
hypertension from
o'clock, which
intravenous
means I
fluids
have
into
more
the
time
blood
to
pressure
plan
at
out to
70
see if they're
90
gonna
mercury. Higher may cause more
see if we can get a
life
good deal on a
loss.
rotisserie chicken, 50% off ideally.
Blood pressure affects
Trying to get
the
back to that.
yet almost one half of those with hypertension
Less
have
sugar in my diet.
symptoms. In addition, it is a major contributing cause in many cases of myocardial infarction, heart failure, and stroke. Most hypertension causes advanced atherosclerosis or arteriosclerosis, which decreases the lumen of the arteries and reduces their elasticity. The high afterload leads to increased
Man, Stitch, that's weird.
hypertrophy and eventually heart failure and ischemia.
Well, thank you.
Hypertension is present.
Friend's a very strong word.
Greater than 130 over 80 millimeters of mercury. Normal blood
Whoa.
pressure is below 120
Look
over
at
80
this.
millimeters of mercury.
Get some weird.
Such as anxiety or
Gotta show my other stream how weird these
especially the systolic blood pressure. So
comments are getting. Holy smokes. You're strong, honey.
That he or she is hypertensive. Instead, you may
Thanks,
say something
Rizo.
like
We
this.
appreciate it.
Your blood pressure is a little high right now. That may be because of the situation today.
You're strong,
You
honey.
should have your blood pressure rechecked a couple of times
Damn,
in the next
Todd.
few weeks under less stressful circumstances.
Yeah, I'll show you.
Persistent
Rizo's
elevation
getting
of the blood
sketchy.
pressure can cause peripheral vascular disease and coronary heart disease and significant.
Wow, I want to marry you, please. I'm 20 years old. You're strong. Some weird, freaking,
heart failure. The latter is a result
weird,
of ventricle having to pump for years against a markedly increased afterload. Signs
You
of
want to see the
systemic
freaky
hypertension
things?
disease.
Man,
In
the internet's
majority of
wild,
cases,
man.
hypertension is entirely
Internet's
asymptomatic
wild,
and is
bro.
detected in routine examination. By the time symptoms start to occur,
Hell nah, bro.
advanced stage, and has probably produced at least some damage to organs such as the heart.
Yo.
Management of hypertensive emergencies. Hypertensive emergencies occur in approximately 1% of all hypertensive patients. A hypertensive emergency.
Bro, I'm lying, fam. I didn't mean it, bro. I didn't mean it, fam. You know, when I start showing the camera, bro. Oh, damn, I can't. I don't even know, bro.
Two end organ emergencies that may result from uncontrolled hypertension were discussed earlier in this
Hell nah, bro.
failure and aortic dissection.
Yo, we gotta, we gotta show him what you saying on the other one, bro. Yo, double stream ting, man. We gotta show, we show back. That's how we like jump on the other stream, you know, like. Yo, that's crazy, bro.
Arterial pressure equals diastolic
That's
blood
crazy,
pressure plus
man.
1/3 of systolic blood pressure minus diastolic
I was
blood pressure.
lying, bro. I was lying, you know, I'm like.
150 millimeters of mercury. The pressure may breach the blood-brain barrier with resultant fluid leaking out, increasing intracranial.
Yo, we just keep going back and forth, bro.
Severe headache, nausea, and vomiting. They are followed by
Stitch.
seizures and alterations in mental status. That is,
David Alexander
sometimes patients
Petku.
may show
Hello.
neurologic signs, such as
Keep just
subconscious
hopping back and
attention,
forth.
disturbances in speech production or
That's
comprehension,
freaking-
or hemiparesis. It is
It's alright, I'm not
often
mad.
environment to differentiate hypertensive and
I'm not
systolic
mad, I'm
into
chilling, you know, like,
or
you don't have to say sorry, it's all good. It's the internet, we just,
lower the blood pressure by no more than 1/3.
nobody's serious, that serious on the internet, you know, like, we're just stupid stuff, man.
Is restored to normal. Excessive lowering of the blood pressure
I'm not here to give you an online degree.
That is best accomplished under controlled conditions in a hospital. Thus, if you are within 20 to 30 minutes of the nearest
This is
hospital,
not your,
treatment only.
Your math course. I know I look Asian, but this is not your online math course, so it's fine, just chill, man, just chill. It's a YouTube. People don't come here. Well, some people come on this website. Pause.
Transport without delay. Be prepared to deal with seizures
People
and-
visit this website. See, I had to say pause, you know what I'm saying? I said some people come on this website. I had to say pause because that sounds disgusting. Some people visit this website
Its purpose is labetalol.
for education.
Its alpha and beta blocking properties. It can only be given if it is within your paramedic scope of practice
Yeah,
and part of
but,
a medical directive or with direct medical control.
I don't even know, man.
Labetalol prevents
I'm too old for this.
thereby decreasing the overall peripheral vascular
Show him what I will type. I was lying, bro. Bro, I was lying, bro.
As a beta blocker, however, labetalol is relatively contraindicated
All right,
in patients with
chill.
asthma and chronic obstructive pulmonary disease. Labetalol can be given initially
Whoa,
by slow
whoa,
intravenous push of 10
whoa,
to 20 milligrams.
whoa.
Within 10 minutes as necessary, or an intravenous drip can be started. If delivered by
What does Rizo have to say? Yo, is
a runaway intravenous line-
Lil bro is too freaky with Go-Go.
Pressure every 2
Gojo, what's
When
Gojo?
the blood pressure has
I even
fallen
know,
to a target
man.
level specified by
Sometimes-
the medical physician, modify subsequent doses or the infusion rate. The other
Please stop it, I was just joking.
Dangerously high blood pressure is nitroglycerin, 0.4 milligrams sublingual.
I believe it's so boring.
First choice for this indication, but its use is acceptable if labetalol is not available.
Come-
Once again, use of nitroglycerin for this
So
purpose is
boring. You're so boring. I'm gonna leave now and just
Whenever you give the
I'm
medication,
gonna say someone else is strong.
measures or her blood pressure at least
I'm gonna go to another live and make
Remember that the only
and be a
reason
troll on
you
somebody
know
else's
blood pressure in
live.
the field is for a hypertensive
And lie
emergency
about my
is
age.
present. Even then, treatment is usually started in the hospital.
Yo, it's wild. So boring. Oh my god.
Cardiac dysrhythmias may arise from a variety of causes. They are not solely caused by myocardial infarction.
Freaking
A
hell,
cardiac
bro.
dysrhythmia is simply a disturbance in the normal cardiac rhythm, which may or
It's
may
funny,
not
like,
be
can't,
clinically Sometimes dysrhythmias are caused by ischemia, electrolyte imbalances, or disturbances or damage in the electrical conduction system, resulting in escaped beats.
Please stop it. I'm sorry, I was
It is
joking.
necessary to evaluate the dysrhythmia in the context of the patient's overall clinical condition. The patient's condition along with the rhythm recognition will ultimately determine whether treatment is necessary and the urgency of
I have no idea what's going
treat the
on.
patient and the monitor.
I have no idea what's going on.
Pre-hospital care of a patient with an acute myocardial
I
infarction
don't
is to
know.
anticipate, recognize, and treat life-threatening dysrhythmias.
Uh-oh.
Dysrhythmias develop after an acute myocardial infarction for two principal reasons. First, irritability of the ischemic heart muscle surrounding the infarct may cause the damaged muscle to generate abnormal currents of electricity that cause abnormal cardiac contractions. When the dysrhythmia arises from irritable spots in the myocardium,
Internet's weird, man.
it is usually a rapid dysrhythmia, tachydysrhythmia.
Yeah, the internet's too weird.
Tachycardia or PVCs. Second, dysrhythmias may occur after an acute myocardial infarction
Man,
because the infarct damages the conduction tissues.
The internet's too weird. I'm too old for this. I'm too old.
Very slow heart rates.
I'm not smart enough, but I'm kind of old now, you know, like...
Proceed electrical instability of the heart. Furthermore, when the sinus rate becomes very slow,
Bro, I have no idea.
in the atrioventricular junction or ventricles may fire, producing escape beats to assist in maintaining cardiac output. Conversely,
No idea, I'm too old for this.
120 to 140 beats per minute increase the work of the heart, causing further myocardial ischemia and damage. Tachycardias may also be associated with decreased cardiac output secondary to decreased stroke volume because the ventricles have less time to fill between beats.
You know what's funny though? Like,
Metabolic alkalosis, hypokalemia, and hypocalcemia can lead to electrical instability. Cells that usually do not have automaticity may then begin to fire impulses. The result is the potential for tachycardias, flutters, and fibrillations in the atrium or ventricles, heralding grave rhythms such as ventricular tachycardia and ventricular fibrillation. Circus re-entry can also be a serious problem. The atrium
man, my freaking engagement numbers are going up.
The other to stimulate cardiac cells that have already depolarized.
It's a bot. Stitch is a bot. Stitch is a bot. Stitch is a bot.
ECG analysis is indicated in any patient who might have a cardiac-related condition or rapid or slow heart rate.
I don't know what Rezo's cooking up something over there.
ECG analysis, but this monitoring should also be instituted for any patient with a history of heart problems. Given that age is
Pretty sure Stitch is a bot.
ECG analysis is appropriate for older patients in many situations. Indeed, the ECG
Man,
should be
this Gen... Is that Gen Alpha?
ECG monitoring and the electrodes. The ECG monitor serves several functions in the pre-hospital setting. The device can be used to continuously monitor.
Hey, I didn't ask you. This is a bot. This is definitely a bot. Rezo, this is a bot, bro. That's straight up a bot. Who says? Bro, if you say nah, that's a bot ting, bro. It's a bot. He's a bot, bro. It might not even be a he.
The cardiac monitor also enables
Cannot. Todd can see if they're bots. Bro, Todd can tell. Todd, look at the username, Todd. Todd, dissect the profile. Todd, dissect the profile. Todd will tell if they're a bot. POV. Todd. Todd will tell. Todd, look into the screen, Todd. Look into the screen. Let us know.
An important component of acute coronary syndrome care is performing a pre-hospital 12-lead ECG with either transmission or interpretation by paramedic personnel.
Uh-oh.
As discussed earlier, pre-hospital 12-lead ECG demonstrates...
I'm reporting you for saying bot. I'm reporting you because you hurt my feelings.
When paramedics activate the cardiac care team, this can result in reductions in reperfusion times and
I'm reporting you hurt my feelings, oh my god.
In virtually all cases, if you suspect the patient is experiencing a cardiac event, you should capture a 12-lead ECG. Although a 3-lead ECG provides a great deal of information, it is very limited compared with the information obtained from a 12-lead.
You know, YouTube is a business,
there are predetermined locations to
right?
electrodes and leads. Electrodes used in the pre-hospital setting are generally adhesive.
You can file your complaint.
To aid in skin contact.
Oh no, what am I going to do?
Electrodes that adhere aggressively to diaphoretic patients. Whichever type is used, certain basic principles should be followed to achieve the best.
What am I going to do? I'm getting reported by a bot. I should really bow down to everybody that enters my live stream, because I'm a slave. Totally. Yeah, man. Totally. Just because, oh, that was the most Karen thing. That was such a Karen move. That, dude, Skynet's done pretty well programming these bots. Got that Karen download function. It's insane. I'm gonna report you. I'm gonna tell the principal. Oh my gosh. He called me a bot. He deserves to be banned. But I lied about my age, and I lied about my age, and I called him strong. But when he called me a bot, that's bullying. Kids, bro. Gen Z, Gen Z. I said I was gonna leave, but I stuck around for another 10 minutes. Welcome to the internet, bro. Welcome to the internet. Yeah, he's such a bully. Called me a bot. Oh my gosh. Dude, just crushed all my confidence. Oh my gosh.
Ensure the monitor has an adequate paper supply.
I've like never been, my feelings have never been this hurt in my life.
If not already connected. Turn on the power to the monitor. Adjust the screen contrast if necessary. Step 2, explain the procedure to the patient.
Step 2, explain the procedure to the patient. Dude, Weezer, you're still there? Dude, Weezer dipped, bro.
Rather than to his or her limbs. Ensure good contact by shaving small amounts of chest hair if needed. Step 3, attach the electrodes to the leads before placing them on the patient. Step 4, position the electrodes on the torso of the patient. Step 5, turn on the monitor and set it to lead 2. Adjust the ECG size.
I have no idea what's going on anymore, bro. It's weird. People are weird, man.
Feel the patient's pulse and compare it with the heart rate indicator on the monitor.
What am I gonna do now?
Set the heart rate alarms on the monitor according to your agency's policy. Step 6, record the tracings. Step 7, label each strip. This is the end of skill drill 30-1.
Actually leave this time though. Actually leave this time. Don't pull that
Right up a chest near the shoulder or right arm for a 12 leg. 2. Left up a chest near the shoulder or left.
Actually leave this time for real though.
Red, left
Been waiting. It's been 10 minutes.
4. Green, sometimes available, right lower abdomen or right.
Holy shoot.
Placing these 3 electrodes on the patient enables the ECG device to record the standard limb leads. 1, 2, 3. Using the eye-open triangle.
I think the bot actually left. No idea.
It emits a tiny amount of electrical energy, which travels across the surface of the skin. Using electrodes and an ECG monitor, these waves of energy can be recorded and plotted on a piece of gray paper. Eindhoven recorded 3 leads initially, leads 1, 2, and 3, where lead 1 was formed between the right and left arms, lead 2 between the right arm and left leg.
Rizo's still in the house. What's up, Rizo? So, like, I have my other channel, realtalk.education. Trying to get that one to monetization. But it's a grind.
Lead 1 is formed between the right and left arm electrodes.
Thanks for the kind words there.
Lead 2 is formed between the right arm and left leg. The left leg electrode is the positive.
Oh, whoa, man, Rizo's writing a rap song right now. Holy smokes, dude, Rizo with the certified comments. Holy smokes, that's certified, bro. Freaking Rizo. Dude, Drewski's got allegations now. Hey? Yo, Drewski's got them allegations. It's crazy, bro. World's crazy, man. Drewski got allegation in that thing, bro. That's all I gotta say, bro.
Produce an isoelectric tracing or very little inflection in any direction. In a normal tracing, the flat horizontal PR between the P wave and the QRS complex, ST, and TP segments form the baseline of the ECG. However, PR depression can occur with pericarditis and ST depression, and elevation can occur with cardiac ischemia.
Let's make sure you know it's like a Skynet.
Thus, the TP segment is typically used as the isoelectric line.
Yeah, it's crazy, man.
Other segments can be compared to determine elevation or depression.
Double stream, bro. Double stream. Double stream. Double stream, double Todd. Todd is always the center of attention. Todd is the only reason.
For example, lead ABR is the electrode at the right arm, referenced against the combination of the left arm and left leg electrodes.
Oh my god. Did you know that it's... Oh, did you know? Well,
calculated point known as the central terminal of Wilson. It is created by bisecting limb leads in the Eindhoven triangle. The electrodes for the unipolar lead to the positive terminals for that lead. Recall that there is only one true pole in unipolar lead systems. The other end of the lead does not have polarity. For example, B1 is positive and the B1
Trappy?
The other end of the lead is the central terminal of Wilson.
Trap BB Lulu?
Reading an ECG rhythm strip.
What?
Part of your role as a paramedic will
Dude, is that a rapper?
ECG strips and be alert for dysrhythmias. Use a systematic approach and examine every strip the same way.
Who's trapped
To assist
BB Lulu?
rhythm identification and ensure you will not overlook any important findings.
I'll
Using
flame
such
you.
approach, you will find, in
I don't know what that
cases,
means.
that even the most complex appearing dysrhythmias can be reduced to simple terms and can be identified correctly.
What does that even mean?
ECGs are recorded at a standard
Gotta educate me, bro.
meters per second. Thus, a given distance on the graph paper represents a given time. Specifically, one small square, 1 millimeter,
you
is equivalent to
feel
0.04 second or 40 milliseconds. One large square, which consists of 5 small squares, is equivalent to 0.20 second or 200 milliseconds.
Oh, no.
0.04 times 5 equals 0.20 second. There are 5 large blocks per second. The format of the 12-lead ECG.
Yeah, it's got,
The gold standard for multi-lead ECGs is the 12-lead ECG. In special situations, a 15-lead ECG may also be performed. 12-lead ECGs have a common lead.
That's funny.
A typical
That
12-lead
was
ECG
mint.
runs at a taper speed of 25 millimeters per
That
second.
was
Although
mint,
this can be
bro.
changed in some in-hospital
That was
ECG
freaking
machines for
mint.
frequent reasons. The speed will always be printed on
Great.
12-lead ECG as confirmation.
Alright, what we
Each
at?
small block is 1 millimeter, and horizontally, time. This corresponds to 0.04 seconds
BRB.
or 40 milliseconds. 5 small blocks make up one larger
You're a little young for me, bro.
The computer interpretation,
Yeah, dude.
therefore, has an advantage as it can analyze the information of all 12 leads for the entire time. Some 12-lead
No, thank
ECGs
you.
also include one or
No,
more rhythm
thank you.
strips
I'm
simultaneously
pretty good,
to assist
man.
with rhythm analysis. Contiguous inferior leads. Lead 2 is contiguous with lead 3. Lead 3 is contiguous with leads 2 and AVF. Lead AVF is contiguous with lead 3. Contiguous septal anterior lateral leads. E1 is contiguous with V2. E2 is contiguous with V1 and V3. E3 is contiguous with V2 and V4. E4 is contiguous
Where's
with
the
V3
bot?
and V5. E5 is contiguous with V4
That's
and
funny.
V6. E6 is contiguous with V5 and lead 1. Lead 1 is contiguous with V6 and AVL. AVL is contiguous with lead 1. Components of an ECG complex. The components of an ECG rhythm correspond to electrical events occurring in the heart, as shown in figure 30-32.
Oh man,
The
the
typical
press was
ECG
insane though,
complex
bro.
is a complex.
the media is insane, bro.
Each of these, as well as the segments and intervals outlined in figure 30-33. E wave.
Yo, true fan. True fan tings, bro. True fan, bro. Real one, bro. Day one, true fan. Since back in December dating, bro. The return was insane, bro. The return was insane, bro. Yo, that's crazy, man. That's freaking crazy, man. Nah, even. I don't
If a P wave is present but not followed by a QR,
It's a lot of work, man. Wake up, freaking.
Ventricular junction or below and is preventing conduction from the atria to the ventricles. These waves can give clues to the pacemaker sites.
Sweet.
Waves that vary in size and configuration mean that there are several pacemaker sites at different locations
Oh
throughout
yeah,
the atrium.
man. You know.
The
Oh
morphology
yeah,
and
totally,
whether they are
bro.
upright or inverse can also give information that there is atrial enlargement or that the pacemaker is in an ectopic location.
I'm pretty sure the bot left. I don't know. I don't know where the bot went. No idea. No idea where the bot went.
It includes the slight delay that normally occurs when the impulse is slowed through the atrioventricular node, allowing time for ventricular filling. The PR interval is measured from the start of the P wave to the point at
It's
which
like,
the
bro,
QRS
it's like,
complex begins.
bro.
Although normally
It's
lasts
weird,
0.1
man. It's
to
weird
0.20
stuff, man. It's some
seconds
weird
or 120
heebie-jeebies kind of
to
thing,
200
bro.
milliseconds. 3 to 5 small squares on the ECG strip. The
bro.
PR interval may be long and give clues that there is first-degree nodal
I
block.
can't even, bro.
Exceeds 0.20
Can't even.
second. 5 small squares, for example, is called first-degree atrioventricular block. And may
Show us your
indicate
watch.
entry into the
What do you mean your watch? I don't got no watch right now. What are we talking about, fam?
Suggests ventricular pre-excitation. QRS starts early via an accessory pathway such as in Wolff-Parkinson-White syndrome. Wolff-Parkinson-White will be discussed in greater
Bro, I'm not that young anymore, bro. Used to wear two pieces.
variable P wave morphology, or a second-degree atrial
Bro, I'm not that
node.
young anymore, bro.
The PR
When I was younger,
usually follows
maybe.
the baseline or isoelectric line, but PR
Who's this?
depression may occur with pericarditis.
Can you show us what you're
Therefore,
watching? I
the
thought you said
segment
watch.
should be used as the isoelectric line, 0 millivolts, to which the
Show
other
me
segments
what
can be
you're
compared
watching.
to local
Whoa.
elevation
This
or
is,
depression.
yo, Gen Z alert. This is a Gen Z. It's definitely a Gen Z. No, please, no manners. Gen Z alert. Gen Z, Gen Z, Gen Z. It's a Gen Z alert, man. Didn't say the word please. Straight Gen Z. It's definitely a Gen Z. No way. You're not Gen Alpha. I heard Gen Alpha's 2025. You're not 1 year young.
This wave represents conduction through the ventricular septum. The Q wave should last no more than 0.04 second or 40 milliseconds and should be less than 1/3 the overall height of the QRS.
Who's the one that? Oh, Firash. I thought you were the same person that said they'd flame me. I don't even know what flaming means. Do it yourself, bud. Not you, Rizzo. It's the other live.
If the S wave is abnormally large, it may indicate hypertrophy of the ventricles. If there is a
The other live has somebody, I think it's a Gen Z, but they're claiming they're a Gen Alpha.
And they indicate trouble in the conduction system of the ventricle. Q waves are abnormal or pathologic if they're
Only Todd can tell. You cannot lie to Todd's eyes. Todd can see through the eyes.
Similarly, if they're deeper than 1/3 of the total height amplitude.
The last challenge is you must beat Todd in a staring contest.
This finding is significant when looking at 12-lead ECGs because it may indicate a current or previous acute myocardial infarction. J point. The J point is the junction or point in the ECG where the QRS complex ends.
That's the last
segment begins.
The last challenge to be.
The end of ventricular depolarization and the apparent beginning of ventricular repolarization.
Yeah, you have to make sure you beat Todd in a staring
It
contest.
makes it easier to identify the ST segment and is often depressed or elevated with the myocardium as ischemic. J point changes will be discussed with 12.
Do I know? So someone, Rizzo, just to give you, someone from the other chat is asking me if I know who iShowSpeed is. Yes, I do know who iShowSpeed is, correct.
An ST segment that is significantly greater than 1 millimeter or 1
Whoa.
square above or below the
Whoa, Rizzo wants flame, bro. Rizzo, just join my other live.
It's
called Real.
Show.
Or the other, this is the other channel, bro. Right here, just join the other live. It's right here. Real Talk Education, right there, bro. Or just join the other live. Real Talk Education. It's my other channel. They're all over here. All over Todd over here.
The first half, closest to the QRS complex, represents a period of time called the absolute refractory period. During the absolute refractory period, the ventricles have not sufficiently repolarized to enable another.
I think they left though. Just join the other live.
If you flush a toilet,
And talk to them there. Getting more people on the other live.
Why? Because the tank has not yet filled back up with water.
2 people. Yeah. I'm so famous.
The relative refractory period indicates that some cells have repolarized.
Anyways.
to depolarize
Okay, and?
Now think about flushing the toilet and waiting 15 seconds before flushing again.
Oh, 15 seconds for flushing the toilet.
Partial flush because perhaps 1/2 the tank was able to
Whoa,
fill with
partial
water before you
flush.
flushed it again. So, during the absolute refractory period, nothing can stimulate the ventricles to contract again at that moment in time. During the relative refractory period, however, a large stimulus can initiate depolarization of those cells that are repolarized and may result in a dangerous heart rhythm. The latter is the reason that synchronized buttons, sync, are used during cardioversion
Whoa.
so that the shock will not be delivered during the precarious
Whoa.
T wave, known as RRT, causing ventricular
Whoa.
fibrillation. TP
Rizzo
segment.
dropped the nah.
TP segment is generally regarded to be the
Holy
isoelectric
smokes,
line or
bro.
baseline. Although the baseline is neither positive or negative,
No,
there
we
is no
haven't.
electrical activity, movement of ions in the myocardium.
Yet.
Perhaps a better phrase to describe the baseline would be a period of
Alright, time to sleep now. Todd, take care of the live. I'm gonna go take a nap. Todd, cover the camera. I'm gonna go sleep. Good night.
The baseline is the reference point to which you compare the J point and ST segment. QT interval. The QT interval represents all
Woke up
the
again.
one complete ventricular cycle. This ventricular depolarization.
Another day at work. Another day at work, man.
The Q wave and ends with the T wave as it
Another
comes
day
back
at
to the
work.
isoelectric line.
You know, I work really hard at my job, you know?
Measurements begin with the R wave. The QT interval normally lasts 0.36 to 0.44 seconds, or 360 to 440 milliseconds. The QT interval varies with gender and age and is dependent on the heart rate. With the
How long have I
QT
been streaming
shorter
for?
or
30
longer.
minutes?
Thus, a formula is used to correct the QT measurement to a heart rate of 60 for comparison. 12-lead ECG computer interpretation accurately calculates this and lists it as QTC. Upper long QT interval, long QT syndrome, indicates that the heart is experiencing an extended refractory period.
Anyways.
Still more vulnerable to dysrhythmias. Such prolonged Elongation may occur with administration of some medications.
I'm trying not to drink that much coffee, just trying to drink water.
Conversely, the QT interval may occur with administration of some medications. Some antidysrhythmics, antibiotics, antifungals, antipsychotics, antidepressants, antihistamines, some electrolyte disturbances, hypokalemia, hypocalcemia, or congenital conditions.
What was I like, bro?
QT is associated with dysrhythmias, especially torus quality, which may be fatal if not treated immediately.
Yeah, you're a little too young.
QT syndrome is a genetic condition.
You're a little too young for me, man. You know, like,
0.45 second, 450
crazy.
milliseconds. Long QT syndrome
Drink some water, man.
ventricular dysrhythmias, which can result in syncope and sudden cardiac arrest. Patients with
I'm ready to roast somebody. Man, Riza's got some pent-up roasting energy. Holy shoot.
EMS is often called to treat
Yeah,
patients
that's
who
weird,
experience
man. You're trying to catch a case over here, bro. Like, freaking.
It is critical to report an EECG.
No, thank you.
Experiencing symptoms,
You know.
including younger patients. Approach to reading an EECG rhythm.
Play GeoGusser? What's that? Is that a game?
Here, a five-step
What's
method.
GeoGusser? Is that a game?
1. Identify the waves P, Q, R, S, T. 2. Measure the PR interval.
No, thank you.
3. Measure the QRS duration. 4.
Half the time to
Determine
sleep.
rhythm regularity. 5. Measure the heart
No,
rate
thank you.
using 120 milliseconds.
a little too
0.12
young,
second
bro.
as the cutoff between narrow and wide QRS complexes will help to differentiate between whether the rhythm
Man, Riza just wants this. Riza, you can just stay here in the confined live, you know. We gave you the opportunity earlier. You wanted to stay, so tis fine, you know. We ain't trying to roast. You want to keep the peace, I guess. GeoGusser.
There is atrioventricular association, sinus, and intermittent association, second-degree
Keeping the
atrioventricular
peace.
blocks, or atrioventricular dissociation, third-degree block. Rhythm regularity.
Full day of just making flash. I gotta finish these flashcards because I spent 2 days on these flashcards.
Measuring the distance between R waves is one method used to evaluate rhythm
What?
regularity. If the RR interval is exactly the same between the QRS complexes, the rhythm is regular. When the RR intervals are not all the same, the rhythm is irregular.
What's GeoGusser?
Separate the irregular rhythm further. If no two RR intervals are
No
equal
idea
distant,
what Geo-
the
is
rhythm
that a
irregularly
song?
Irregular. For example, atrial fibrillation. If the R waves are irregular, but appear to
Alright, I'm
follow
not gonna look it
the
up,
rhythm
don't
is
worry.
regularly irregular. For example, you obtain the following data when measuring the distance between R waves.
I don't know what that
25
is.
millimeters, 35 millimeters, 25 millimeters, 25 millimeters, 35 millimeters, 25 millimeters. This represents
No
a
idea,
regular
man.
rhythm. ECG calibers
You can get used to
are
double streaming.
used as the ruler.
I'm
Determining
pretty
heart rate.
impressed. Usually my
Describe
internet's
some of the more
complete
common methods of
garbage.
Using a cardiac rhythm script to determine heart rate. The 6-second method. The 6-second method is the fastest
okay.
method to measure heart rate from the ECG.
I'm trying to finish up these,
In fact,
these
it is the best
flashcards.
method for calculating heart rate when the rhythm is irregular. Count the number of QRS complexes in a 6-second strip and multiply the number by 10 to obtain.
Man, I even know Rizo's on some next level stuff.
The sequence method should be used to determine the heart rate only when the rhythm
Apparently
is
it's a game.
First,
I don't know.
analyze the following sequence. 300, 150, 100,
Yeah,
75,
people are
60,
weird. I
50.
don't even know.
Find an R wave on a heavy line, large square, and count off 300, 150, 100, 75, 60, 50 for each
I don't
large
know.
square
Too many
until
people.
you reach the next R wave.
2 whole people. One on each live stream. Too much to handle.
As an example, if the
I'm not
R
ready
wave
for the
is
fame.
successive
One
QRS
person's too
complexes
much to
3
handle.
boxes apart, the heart rate is approximately 100 beats per minute. If the RR interval spans fewer than 3 large squares, the rate is greater than 100, tachycardia. If it covers more than 5 large squares,
Dude, it's
the
about
rate
to-
is less
it's
than
almost
60
time for a
per
nap.
million. The 1500 method. The 1500
Whew.
method is the most accurate way to calculate the heart rate from the ECG.
No, you can't, Farash, because I'm not monetized on this channel.
And only when the rhythm is regular.
I am monetized on my other channel,
Of small boxes between any two QRS complexes. The RR
where Rizo's chatting up over here.
Figure 30-44, for example,
My other channel.
23 small boxes between two successive QRS
Working on monetization on this channel right now.
65. This calculation yields a rate of approximately 65 beats per minute. Specific cardiac dysrhythmias. As discussed earlier, cardiac dysrhythmias can be induced by a
Anyways.
variety of causes. Ischemia, infarction, or scarring can lead to conduction problems such as atrioventricular node
Working on
blocks.
monetization, people.
Alternatively,
Working monetization.
infarction can also lead to ectopic foci causing premature beats. A number of factors can contribute to premature beats and other dysrhythmias. Some dysrhythmias, such as ventricular fibrillation, lead to cardiac arrest. Bradycardias and tachycardias may cause reduced cardiac output.
I can't
and subsequent
donate.
ischemia and shock.
They
Other
sus.
dysrhythmias, such as atrial
They
fibrillation,
sus.
rarely cause death directly, but can lead
They
to
sus or
cardiac
that's
arrest
sus?
and complications such as stroke. Rhythms of the
Can't tell.
sinoatrial node. Normal sinus rhythm. The sinoatrial
I
node is
can't
the primary
donate.
case
They
feature for the heart.
sus.
A normal sinus rhythm arises in the sinoatrial node, has an intrinsic rate of 60 to 100 beats per minute. The rhythm is regular, with minimal variation between RR intervals.
What's up, Rizzo?
An upright P wave proceeds
Can
each
you
Q
say
R
my
as
name?
complex. The P
Heisenberg.
0.12, 0.20 second, 120 to 200 milliseconds. The QRS complex measures 0.1.
I don't compare random accounts on social media, so I'm not going to answer that question. Next question, please.
The rhythm is regular and an upright P wave proceeds each
Firash Izzy.
The PR interval is 0.12 to 0.20 second, 120 to 200 milliseconds.
Time
The
to sleep,
QRS
man.
complex is 0.
I think it's time to sleep.
110
Too much work, man. I'm looking at like four
A
screens right now, man.
usually less than 50 beats per minute, leads to inadequate cardiac output and often
Myself a
precipitates
coffee.
instability of the heart.
Hold on, wait a
Furthermore,
minute.
when the sinus
Y'all
rate
thought I
is
was
very slow,
finished?
ectopic pacemakers in the atrioventricular junction or ventricles may fire, and protus leads to assist in maintaining cardiac output. Sinus bradycardia can be a asymptomatic phenomenon in healthy adults, and conditioned athletes and may occur during sleep. More serious causes include hypothermia, sinoatrial node disease, acute myocardial infarction, which may
18.
stimulate
How many?
vagal tone, parasympathetic stimulation,
Dude, I'm getting tired of doing all these flashcards. That's all I gotta say.
calcium channel blockers, morphine,
Frick,
quinidine,
man.
including interactions between quinidine and some calcium channel blockers.
You like
which
Goku or
toxic.
Vegeta?
In general, treatment focuses
I don't even
on
watch that
tolerance
show.
for bradycardia
I'm gonna say
and for
Goku.
positive factors. Agripine may be
I'll say
necessary.
Goku.
Patients who are symptomatic and do not respond to agripine may require a transcutaneous pacemaker to assist the heart rate
Transcutaneous
increase at
pacemaker.
regular rate. Transcutaneous cardiac pacing will be discussed later in the chapter.
Yeah, I think it's time for
By
a
definition,
snack.
a tachycardia has a ventricular rate
Oh, I gotta make some
100 beats per
food
minute.
and then freaking
With sinus
sleep.
tachycardia, the sinoatrial node is still the pacemaker,
Whew.
but the heart rate is typically 101 to 180 beats per minute in a resting adult. Experts note that the upper rate of sinus tachycardia is age-related and can be calculated as approximately 220 beats per minute minus the patient's age.
Got bad news?
The rhythm is regular, and an upright P wave precedes each QRS complex.
Bye,
It is
Farash.
occasionally difficult to see if it is partially buried in the T wave of the beat before it. The PR interval is 0.12 to 0.20 second, 100.
What's the bad news, bud?
milliseconds.
What's up, bud?
QRS complex
Bad
is
news, bud.
0.11 second,
Pretty sure there's only
100
48
milliseconds or
chapters,
less.
but
Sinus tachycardia may result from a variety of causes, including
no idea how many
fever,
chapters.
hypoxia, hypovolemia,
Well, we'll see.
exercise,
Let me just go
sympathetic
here.
nervous system stimulation
Copy.
caused by stress, fright, or anxiety,
Paste.
acute myocardial infarction, pump failure.
I got bad news. What's the bad news, bro?
Nicotine, alcohol,
Yeah, it's only 48 chapters. I'm on chapter 44. I'm freaking plowing through these
can cause
questions
tachycardia.
right now.
Hypoxia, metabolic alkalosis,
Can you say skibbity?
hypocalcemia can lead to electrical
Skibbity?
instability, prompting the firing of cells that normally do not generate impulses. Prolonged tachycardia increases the work of the heart, leading to further ischemia during an acute myocardial infarction. In addition, cardiac output may be significantly reduced when the heart rate
Skibbity.
exceeds 150
What's a
beats per minute
skibbity?
because the ventricles do not have enough time between contractions to fill completely with blood. The treatment of sinus tachycardia is related to the underlying cause.
I'm sorry to hear about
Sinus
that.
dysrhythmia. Sinus
That is
dysrhythmia
bad
a
news.
variation in cycling of a sinus rhythm.
Should go call your family. That's actually very unfortunate.
Between the longest and shortest cycles, that is often associated
You
with
should
respiratory cycle
go
fluctuations.
check on your family.
The rate increases during inspiration and decreases during expiration.
I'm gonna say Sigma and Skibbity? Holy smoke, I thought you were leaving. You said bye already, Farash. What's going on? I thought you were leaving. I thought you were gonna go leave this channel, go watch T-Series. I thought you were gonna leave my channel, go check out Mr. Beast or T-Series. But you want me to say Skibbity and Sigma. Too much work.
Sinus dysrhythmia is usually due to
Get him
changes in
back,
the
you know,
heart rate
take
of the
a photo
respiratory
over
cycle
here.
and is more prominent in adults, children and young adults.
We got a Chinese guy
It tends to
now.
diminish or disappear with age.
I'll say Sigma, bud.
Is often somewhat more prominent with fluctuation in the respiratory cycle because the heart rate accelerates with inspiration and slows with expiration. Increased filling pressures of the heart during inspiration stimulate the Bainbridge reflex, which increases the heart rate and is partially responsible for respiratory sinus dysrhythmia. The increased filling
Whoa,
pressure of the
this
heart
person-
raises stroke volume,
this person just said
increases
T-Series
stomach
sucks.
and blood pressure. The increase in blood pressure stimulates the baroreceptor
Mr. Beast fan over here.
which attempts to block
Straight
the
up just said
increase caused by
T-Series
Bainbridge
sucks.
reflex.
Ouch.
In this way, the
It's
baroreceptor
dissing
stimulates
T-Series,
the
bro. It's like
sinus
the
dysrhythmia.
second most subscribed channel on YouTube.
Sinus arrest occurs when the sinoatrial node fails to initiate an impulse.
Yeah, you should stay home from that.
As complex, or a T wave for one
You
cardiac
should. It's
cycle.
dangerous out
After
there.
this missed set of waveforms, the sinoatrial node resumes normal functioning as if nothing ever happened. In sinus arrest, the atrial and ventricular rates are usually within normal limits, and the rhythm is regular except for the absent complexes. Key waves are present in upright, preceding every QRS complex, and the PR interval, when present, is 0.12 to 0.20 second.
I even know this is Sigma Alpha Man. What?
The QRS complex, when present,
Let me
is
get myself another
0.11
coffee.
second, 110 milliseconds.
Ugh, gosh.
Possible causes of sinus arrest include ischemia of the sinoatrial node, increased vagal tone, carotid sinus massage, and the use of medications such as digitalis and quinine. Occasional episodes of sinus arrest are not significant. However, if the heart rate drops below 60 beats per minute, cardiac output may fall, and an ectopic focus from either the atrioventricular junction or the ventricles may take over. In such a case, treatment is based on the patient's overall heart rate and tolerance. He or she may benefit from a temporary pacemaker, a transcutaneous pacer in the pre-hospital setting, or a permanent pacemaker after admission to the medical facility. Sick sinus syndrome. Sick sinus syndrome encompasses a variety of rhythms that involve a poorly functioning sinoatrial node and is common in older patients. On ECG, sick sinus syndrome announces itself in many ways, including sinus bradycardia, sinus arrest, sinoatrial block, and alternating patterns of extreme.
Rizo, you need to stay home and you got to work on yourself. Roasting will not help you with your current situation. Roasting will not help. You must find peace yourself, Rizo. If you're curious, if you go to my main channel, you'll see my 5 channels at the bottom. But as of now, I will not show you. How many questions are here? Holy smokes. Oh, yeah. Not my thing anymore, man. Are we done this freaking... That is not how you find calmness, Rizo. That is not what Todd does not approve of this. You've already had 1 roast today. That is enough, sir. Rizo, we appreciate the energy, but we do not promote full-on roasting. I know when to say no. And no is no unless you can find it yourself and help yourself, but I will not assist in this roasting. It's not the community that we're trying to promote here. Oh.
120 to 200 milliseconds, but may vary slightly based on the origin of the premature complex. The QRS complex measures 0.11 second, 110 milliseconds. Premature atrial complexes are very common and can be caused by stress, such as caffeine, or conditions such as heart failure.
Rizo made it. Holy smokes, Rizo went on the channel. Rizo found the other channel. Just completely jumped ship. Whoa, Rizo straight up found the channel. Look at that. Straight up computer genius over here. Holy smokes. How did Rizo find? Too bad there's nobody on this other live stream. So. I tricked you! I'm pretty sure Farash. Pretty sure Farash left.
At a lower heart rate, P waves can be identified. The rhythm is regular.
So there's no one to roast now, unless somebody else from the algorithm joins. I don't think Farash is still here.
Atrial flutter. Atrial flutter is a rhythm.
Anyways, time to.
At a rate much too rapid for the ventricles to keep up. The atrial complexes in atrial flutter are known as flutter or F waves, rather than P waves.
That's a F waves.
Have a distinctive shape, resembling a sawtooth picket fence.
I guess I'll end the stream on Max the Mindful Man.
Is blocked by the atrioventricular node, resulting in several flutter waves before each QRS complex. The rhythm may be regular, most common, with a constant, usually 2 to 1, conduction, typically at a rate of exactly 150, or irregular if the conduction of impulses to the ventricles varies. The PR interval will measure 0.12 to 0.20 second, 120 to 200 milliseconds.
Roast time, no one's here.
Complex will measure 0.11 second, 100 milliseconds, or less.
Good job, Will.
Atrial flutter is usually a sign of a serious heart problem. In many cases,
A serious heart problem. How serious is heart problem?
Treatment generally consists of medication or electrocardioversion, although neither of these measures is usually attempted in the pre-hospital environment unless the patient's condition is very critical and transport time is long. Atrial fibrillation. Atrial fibrillation is a rhythm in which the atrium no longer contracts, but rather
Go get some groceries at 7:30. Get some cheap rotisserie chickens.
polarized independently, rather than in response to an impulse from the sinoatrial node. The result of this random depolarization, which occurs throughout the atria, is a fibrillating or chaotic baseline. In
Nice day
atrial
today.
fibrillation, there are usually no visible P waves on the ECG. Hence,
A nice
no
summer
P
day
interval
today.
to measure. Instead, one of the hallmarks to identifying this condition is its irregular appearance. Because the atrioventricular node is bombarded with impulses from the fibrillating atria, it allows impulses to pass onto the ventricles in a random manner, which results in a highly irregular ventricular rhythm. The QRS complex typically measures 0.11 second, 110 milliseconds, or less. Atrial fibrillation is not usually a sign of a serious heart problem, and is a fairly common rhythm among older patients. One of the main hazards associated with this dysrhythmia is that the blood within the fibrillating atria has a tendency to form small clots, which may then become emboli and block circulation elsewhere in the body. Because of this risk, many patients whose normal rhythm is atrial fibrillation take an anticoagulant medication to
I
prevent
do like
stroke from
sweetener in the
thrombotic
coffee.
clot. They are also commonly on rate-controlling agents such as beta blockers or calcium channel blockers.
Whoa.
Although younger patients with atrial fibrillation
Stitch is
may
back?
develop a sinus rhythm, older patients are typically rate-controlled rather than rhythm-controlled. Pre-hospital treatment of atrial
Yo.
fibrillation is supported here.
Yo, it's a freaking brawl. Holy shoot. Yo. Crazy, bro. Let's go. Let's freaking go, man.
Tachycardia is characterized by a rate of more than 100 beats per minute.
That's crazy, bro.
The
Yo.
rhythm is irregular. with
Two Gen Alphas, man.
based on the site
That's
of the pacemaker
crazy,
for that
man.
particular complex. An upright P wave
Naho.
QRS complex.
Naho, bro.
However,
Naho
varies,
Karaman.
with multiple sites of origin.
Naho Karaman, you know.
0.12 to 0.27,
Naho Karaman.
120 to 200 milliseconds, but also varies slightly based
Oh,
on the origin.
bro,
of the
it's
particular
Stitch versus Rizzo Gibor.
device. Increases to a rate exceeding 150 beats per minute, then the P wave may no longer be visible.
Freaking-
Thus, the only indication of the rhythm
The typing
irregularity
wars.
associated with the varying sites of origin within the atrium.
Oh, damn, bro. So much positivity, man.
110 milliseconds or less. Multifocal atrial
Oh, Stitch is here too. Yo, Farash is still there? Holy shoot, I thought. Dude, Farash just came off the bench. Has entered the game, just got substituted in. Whoa. Farash just... Bro, it's 2-on-1 right now. This is weird, bro. This is some 2v1 crazy things, bro. Holy smokes, ha ha ha, bro, this is... What's going on? Bro, it's like, we need the backup, bro. Bro, this is... Bro, this is like... crazy. Just trying to have my lunch right now, and freaking... You got Stitch and Farash. I think Rizzo... Nah, Rizzo's got energy. Rizzo can take on the other two. Nah, bro. Nah, bro. Rizzo's good. Rizzo don't need no help, bro. Rizzo's good. Rizzo's got that pent up flame and energy, supposedly, so. Uh-oh. Stitch fires off the first diss. What is Rizzo going to say? What is Rizzo going to say? Oh, snap. Farash just comes. Bro, Farash just with the sneak diss as well. Bro, this is about to get interesting. We're not even at halftime yet. I gotta switch up the angle. Todd. Dude, Todd. Stand up, bet. You know I'm done. Whoa. Whoa. Oh, it's about to be a brawl. Holy smokes, Todd. This P wave is usually followed immediately by the QRS complex. If the impulse I feel like Todd's gonna like... Todd, you're supposed to be a referee. What are you doing? Dude, Todd's supposed to be reffing this match. I don't know what Todd's doing. Todd, you're not supposed to just stand there. You're supposed to be blowing the whistle. Damn it. Because the intrinsic rate of the atrioventricular node is 40 to 60, junctional rhythms normally present with rates of 40 to 60 beats per minute. Man, too many, let me get my sweetener out of here.
The atrioventricular junction takes over as the pacemaker of the heart at a rate of 40 to 60 beats per minute. Usually regular, with little variation in intervals. The P wave may be absent or occur before or after the QRS complex. If an inverted P wave is present before the QRS, then the PR interval will measure less than 0.12 seconds, 120 milliseconds. The QRS complex measures 0.11 second, 110 milliseconds. or
What?
less.
Bet kid, nah, go cry. Ouch. Need to touch grass. What? What's going on?
Myocardial infarction and other conditions, or it can occur after resuscitation from cardiac arrest. Because of the slow rate, treatment in symptomatic patients depends on the underlying cause and may require a surgically implanted pacemaker. In the field,
This is getting. We need to get some more like intense trap music in the background for this like face off right now.
accelerated junctional rhythm.
This is like international, man. This is international. The type wars.
60 beats per minute but remains less
No
than
Star Wars. This is straight up typing wars, man.
The rhythm is accelerated junctional rhythm.
Uh-oh. The emojis are getting flown out here.
Little variation between RR intervals. The P wave
I'm just trying to listen to my textbook, man. These, this is straight duking it out on the live over here. Need to touch grass. I even know. I'm trying to keep up with all this chat craziness, bro. I didn't know that Farash was still, like, on the live. That's crazy. I thought Farash totally left. Is it Farash? Yeah, Farash easy.
Junctional tachycardia.
Junctional tachycardia.
Rhythm will present with a rate that exceeds 100 beats per minute.
Holy smokes. Gotta throw a party for my day ones.
The P wave, if present, is
They don't
inverted
lay
upside
some.
down but may appear to be absent. The PR interval, if an inverted P wave is present, will measure less than 0.12 second, 120 milliseconds. The QRS complex will measure 0.11 second, 110 millisieverts, or less. Junctional tachycardia is serious, but it seldom requires treatment in the pre-hospital setting because the rate is usually fast enough to maintain a reasonable cardiac output. If the rate exceeds 100 beats per minute,
damn.
however, the cardiac
Man
output
put his
remains
song
at
on.
100. In such a case,
What's
the
the
rhythm is
song,
very
though?
functional and is referred to as
Double
ventricular
stream,
tachycardia.
yo.
Premature junctional
Double
complex.
stream.
Premature
Double
junctional
stream.
complex is not, strictly speaking, a
Double
dystrophy,
stream,
just as
everybody.
premature
We're back to the
atrial
double
complex is
stream
not,
action.
but rather an early complex
You know what
that
I'm
occurs
saying?
within another rhythm. Premature junctional
Gotta
complexes
charge
are
up the
also
phone
known as
right now.
atopic complexes, meaning that they arise from a site other than the sinoatrial node. A premature junctional
Oh,
complex
shoot.
also occurs earlier
Oh,
in time than the
shoot.
expected sinus complex, causing the RR interval.
Nah, I'd win. Like, was it a rap battle now? It's getting dangerous now, boys. It's a freaking rap battle. It's about to be a rap battle. This is dangerous. It's not even, we're not even messing around anymore. Let's put my background on right now. Dude, I gotta charge my phone. It's gonna die, fam. It's gonna stay. Dude, this is not good. I don't feel like holding the phone right now. This is... Nah, I'd win. Luckily, I got the chat on. Bro, it's too much work, man. Gotta put on a background right now. Here, put on a background. Just put on a background. Lay the phone down, put on a background. Brain rot. Oh, snap. You're just saying brain rot. This is not even... Dude, this is not PG anymore. Yo, Wimo. Just make a Japanese joke, fam. Holy smokes.
The least serious atrioventricular block is a first-degree atrioventricular block. The most serious is
Sideways
a
on this
third-degree
thing.
block. In between are two types of second.
Put a background, bro. I don't even know what I'm doing half the time.
A first-degree atrioventricular block occurs when
Orientation is locked.
atrioventricular node is delayed slightly longer than is expected and results in a PR interval greater than 0.
What happens if I
200 milliseconds. Each impulse eventually passes through the atrioventricular
rotate
node,
device back?
generating the QRS
What?
complex. This block is considered the least serious. Nevertheless, it is often the first indication of damage that has occurred to the atrioventricular node. Because it originates from
You know what? We're just gonna leave the background on. Just leave the background. Ouch. Ouch. Oh, it's getting wild up in here. It's getting wild. Todd, take back the A position. Take back the A position, Todd. Muhammad, what's up?
Will measure greater than 0.20 second, 200 milliseconds, and is constant in duration. The QRS complex will measure 0.11 second, 110 milliseconds.
Opposite of sigma. What's the opposite of sigma?
And normal sinus rhythm is
Oh, darn it.
First degree atrioventricular block
Hey,
is
Farash,
rare
what's
in
up?
pre-hospital setting unless it is associated with bradycardia that
I'm
results
doing
in
well, Muhammad. Yourself?
cardiac output. Second degree atrioventricular block. Morbus type 1, Blankenbach. A second degree atrioventricular block occurs when an impulse reaching the
Suman Panera, what's up? Shout out Suman Panera.
and generating the QRS complex.
Suman Panera on the other stream. Double stream. What's going on?
Occurs when each successive
Is
impulse
Stitch still there? I don't know if Stitch is. We're double streaming right now, so I don't know.
Because it begins from the normal pace,
Got my coffee on, so
block usually has
shout out
a rate of 60 to
Suman.
100 beats per minute, although it typically occurs at the low end of this range. The rhythm is irregular, with a prolonged
Shout out Muhammad. So Muhammad, how's everything going?
And the QRS complex after the first unblocked P wave. The P wave is present and upright.
I gotta take a sip of this coffee. We're going hard right now, bro. PR interval. Holy smokes, what's going on here?
20 to 200 milliseconds. But with each successive P wave grows longer. It finally
Is
results
Stitch
in
still there? I have
QRS
no idea. Is
complex,
Stitch still
QRS
there?
complex, but by another P wave. This P wave is then followed by
Farash got positive aura.
normal PR interval. This pattern repeats over and over in the rhythm. The QRS
Suiman.
complex measures 0.11
Suiman.
seconds, 10 milliseconds or less. The key to
Suiman.
identification type 1 block atrial ventricular block is the recognition of the
Suiman.
PR interval followed by the P wave without a QRS complex. This rhythm is always irregular, and you can often easily see the wide RR interval with the extra P wave located.
Gotta switch the background over here, bud. Gotta switch the background over here, bud.
With bradycardia that results in significantly reduced cardiac output. Second-degree atrioventricular block. Movements type
Oh
2
shoot.
Second-degree atrioventricular block.
There you go.
Movements type 2 occurs when several impulses are not allowed to continue. It is sometimes called classical because it was well
There you go. It's a good background.
Discovered. Because it originates from the normal pacemaker of the
Can
heart,
you spell
the
run?
block usually has an intrinsic rate of 60 to 100 beats per
What?
minute, although it typically
R-U-N?
occurs at the low end of this range. The rhythm may be regular, with every other P wave block.
The rhythm may be
With
regular.
a prolonged RR interval between the last QRS complex before the blocked P wave and the QRS complex after the first
Ligma.
blocked P wave. The P wave is
Oh,
present and
whoa.
constant, and it precedes some
Whoa,
QRS complex.
did someone just start
The
saying
PR interval is always constant. In fact, this is the easiest way to identify a
R-U-N?
type 2 atrioventricular block. If you see a rhythm with some non-conductive P waves,
What's
the
R-U-
interval
is that a
constant
joke?
non-conductive P waves and their corresponding QRS complexes,
No, man.
you have
It's not even my
identified
thing
a secondary type 2
anymore, bro.
atrioventricular
A little
block.
too,
It is important to remember that this block can be regular or irregular. Sometimes several normal beats will occur without a non-conductive P wave. Sometimes two or
Also,
more non-conductive
Casey knows I
beats
hate
occur before one
teaming.
P wave is conducted.
I'm not teaming, and I got second position in
One conducted P wave followed by
What?
one conducted P wave. Second degree type 2 atrioventricular
Day
block
2 without his girl.
hospital setting only
Damn,
occurs
Muhammad.
with bradycardia that
Muhammad,
results in significantly
bro,
reduced
bro.
cardiac output. Although second degree type 2 atrioventricular block with symptoms may respond to medications, transcutaneous paces.
Stop the fries background. I'm fasting. Alright. 1 second, everybody.
A third degree atrioventricular
Here,
block
we'll show the sky. There you go.
ventricular
Here's
junction
sky.
prevented from proceeding to the ventricles and generating a QRS complex. Unlike in first and second degree atrioventricular blocks, in a third degree atrioventricular block, all impulses from the atria are prevented from traveling to the ventricles.
Honestly, I was gonna get a touch up on my fade today, but I'm being cheap, so.
Because all impulses from the atria
You know what? We gotta put Todd back in the background. Where's Todd?
circulation of blood, albeit at a greatly reduced rate.
There you go, Todd.
Originates from the normal pacemaker of the heart. Atrioventricular block
I was gonna get a touch out on my fade today, but I'm being cheap, so maybe.
depends on the activity of the ventricular.
Maybe. They just opened an hour ago, the hairdresser. The barber's downstairs, so I don't freaking know.
It originates in the ventricles. The rhythm is usually regular, with the PP and RR intervals being consistent.
Okay.
The P wave is present and upright. The PR
Stop with the fries background.
The block is non-existent. The classic way of
Yeah,
identifying
take a sip of this coffee. We're trying to handle 2 live streams right now. It's a lot of work.
and then be unable to identify a relationship between the P waves.
Yo, Rizzo went on my other stream?
Because the ventricular rate depends on the presence of the ventricular.
How many
pacemaker,
streams?
it is common to see the
Did
QRS
Rizzo just hop
complexes
between
in
all the
third degree
accounts?
ventricular
Holy
block that are
smokes.
0.12 seconds.
Holy smokes, Rizzo's like Batman.
When you see QRS complexes with a regular RR
Dude, Rizzo just hopped on the other stream. This is dangerous, bro. Rizzo's like Batman. Holy smokes. Freaking just went to my channel, just knew exactly. That's crazy, bro. That's some crazy hacking. Holy smokes. That's crazy. How do you know which channel? That's crazy, man.
If the QRS complexes are wide, the rhythm typically will not respond to atropine, and the patient will usually...
Pretty sure Farash left the other live
However,
too.
if the QRS complexes are narrow, they are usually from the atrial
Whoa,
node or high in the
man.
bundle of this and may respond to atropine.
Rizzo just,
Rhythms of the ventricles. If the sinoatrial node fails to
Thanks,
initiate
but
the
whose
impulse,
daughter-
the
what?
atrioventricular junction will usually take over as pacemaker. If the atrioventricular junction cannot perform this duty, however, the ventricles may begin to originate their own impulses and become the pacemaker of the heart.
Man,
Such ventricular rhythms will have missing P waves and wide
that's
QRS
weird, bro.
complexes. If an impulse is generated in the ventricles, it must travel through the ventricles in a cell-to-cell manner because the cell...
I don't know what Suman does. Is Suman a bot?
Induction system. Because impulses
Freak,
travel
man.
more slowly via cell-to-cell transmission than
I don't even know half the time, bro. Chat, I don't even know chat. What's going on, chat?
Very wide QRS complexes, more than 0.2.
I don't know if Suman's given a promotion or like what's going on right now, but
The rate of the ventricles is 20 to 40. Ventricular rhythms normally demonstrate rates of 20 to 40 beats per minute. Idioventricular rhythm. An idioventricular, produced by the ventricles, rhythm occurs when the sinoatrial and atrioventricular nodes fail, and the ventricles must take over pacing the heart. It has a rate of 20 to 40 beats per minute owing to the intrinsic...
Why do I like Drake? Drake's got good music. What are you talking about, bro?
Is usually regular, with little variation between RR intervals.
Dude, Drake's actually got good music, though. What are you saying, bro? Yo, don't hate on Aubrey. The heck?
The QRS complex will measure 0.12 second, 120 milliseconds, or more because it originates in the ventricles.
I have no idea which freaking live Rizzo's on. Rizzo's on like 2 lives right now, man. Like, no idea what's going on.
If possible, treating the underlying cause. In such a case,
But he likes minor. I don't know about that. It's on the news. We don't know if that's a fact. Drake actually has good music, bro. Y'all was bumping to Give Me a Hug. Y'all was bumping to Give Me a Hug. Y'all was bumping Nokia. Don't act like you ain't bumping.
In this case, the rhythm is called an accelerated idioventricular
Man,
rhythm.
Suman, bro. Suman's a parrot, bro.
With little variation between RR intervals. The P waves are absent, so the PR interval does not exist. The QRS complex measures 0.12 second, 120 milliseconds, or more. Accelerated idioventricular rhythm.
Alright, gotta end the stream over here on the other end.